Take your knees over toes work to the next level with this routine to break up scar tissue. Are you doing heel elevated squats but not getting anywhere? You have scar tissue around your knee and it's causing your patella to not track properly. Here's what you need to do. First thing we're going to do is we're going to use this muscle scraping tool from Sidekick that I'm going to use to break up the scar tissue around my patella and knee to make sure that our patella can freely move and track properly. I'm going to use a little bit of cream right over top of my knee so that way it glides. And with my knee bent like I want it to be, I'm going to then proceed to scrape all around my patella, framing out the edges and borders. I'm not going right over top of the patella itself. There'll be no benefit to that. It'll probably just not feel great. What you can do is, as you're finding areas that feel more lumpy and bumpy, kind of like you're going over gravel, maybe even like a little uncomfortable or painful, like I feel here. I feel that back of my hand because this device has really good quality steel that vibrates well into my hand when I hit scar tissue. So when I found that scar tissue, that bumpy, lumpy feeling, I'm going to hang out there for about 30 seconds before I go to the next spot. What you can do to add a little bit more to this is you can actually, if you can be down here, get into that heel elevated deep squat and continue to frame out around your knee. The final thing you can do with a muscle scraping tool that you can't really do with many other things or other tools is you can squat up and down while continuing to scrape around the patella. If you're moving with it, I'd say do it about 10 times or so. If you're just hanging out there, again, continue with 20 seconds or so on areas that you feel need it the most. Now what we're going to do is after I've spent about 2 minutes or so working through my patella, I'm going to sit back down and I'm going to use some muscle floss to continue to break up the scar tissue around my knee and generally around my patella. We prefer to use rock floss, but there are many types of floss out there that you can use. I'm going to start below my kneecap on the bump below, and I'm going to lay down one little strip here. Once I have good tension, I don't have to worry anymore about it slipping, so I can pull as hard as I want, and I'm going to lay one more down below the knee, and then I'm going to start coming above my kneecap, so that way I've created this little window here for my patella. I'm going to keep coming. Now I can unravel that a bit. I'm not going to go too much higher because I'm going to even come down below the knee one more time. And then just like you're trying to tie off a balloon, you put your thumb in there so that way you can slide the strip down. I have really good tension here. It's quite uncomfortable, but bearable right now. If I sat here for too long, my toes would start to go numb, which is what should happen when you have the right amount of tension. Now what I'm going to do is you can stay seated if you wanted, and you can do knee extension and flexion, really bringing that heel all the way in and getting it out for about 10 reps. You'll feel the resistance from the band if you have it on there really tightly, which you should. What you can also do, just like we did with the muscle scraping, to get a little bit more out of it, get your heels elevated again, careful with the band on there, and then you're gonna squat down and up. This is like a special kind of awful, because when you get down there, you're really breaking up that scar tissue, and I don't even just feel around my kneecap. You're also getting your calf and your hamstring in there, your IT bands, your groin, your adductor. You're making sure that you're not missing anything. You're gonna do about 10 reps of this. This in particular, I like a lot. What I recommend is going between scraping for a couple of minutes and then muscle flossing for about 10 reps and maybe doing 2 to 3 rounds of that. Then take this off. And pro tip, by the way, that's why I like to put this underneath like this so that way I can quickly get it off once I unravel. So once you finish through your routine, you should recheck your heel elevated squats, and what you should feel, I actually feel myself truly sinking much deeper into this, and that was not intended, believe it or not. I can feel so much more ease of range of motion on my right side. I don't feel my kneecap sliding or gliding, clicking or popping. And now what I would do is I'd repeat that same thing on my left side just to even it out. Do this every time you're about to squat for the best effect. And if you do this at least once a day, especially if you're having knee pain, you'll see large differences in about 2 weeks. Comment, let us know how it goes, ask any questions you might have. Thanks for watching.